Hey, Dr. Lori here from Georgia Holistic Dentist to talk about Biteguards and Airway appliances. So there are lots of different kinds of Biteguards and night guards to prevent wear on teeth at night. So there's a thicker, hard Biteguard. Sometimes they cover the whole teeth, but usually not the whole palate. And these are really snug fitting and they're hard. And so the idea is that this is a flat plane, so if indeed you grind your teeth at night, which is really part of an airway issue, if you grind your teeth at night, the lower teeth can just slide. Think of Bambi on a frozen lake and he can't get any traction with his hooves on the ice. You don't want any traction. You want this to be flat and just grind on the Biteguard. And that way that protects your teeth. But the whole grinding issue is part of an airway issue, so we can talk about that. Now sometimes people have something that holds their mouth open at night, and yes, that will keep your teeth from grinding. And this is just one sample. There's many different kinds, but the idea is if you keep the teeth apart, then you won't grind them. But it makes the airway issue worse because mouth breathing is really the cause of the airway issue. So some little Biteguards are different and some are just for front teeth, but you don't want to do something just on your front teeth for long term because the back teeth will move. Now there are here just a retainer, and if your teeth are crowded, that's a sign of a lip pulling too tight on crowded teeth. And so just to hold them in that position, if you're not interested in straightening them with clear aligners or clear braces, then you can just hold them as a retainer, and that's a thinner, semi-flexible, little bit rigid material just to hold those and to keep those teeth from crowding, because it's the swallow pattern that actually crowds the teeth. So 3,000 times a day with a lip pulling too tight is what actually crowds front teeth. So if you hold the lowers with a retainer, typically the uppers will stay in that same position, and so a lower retainer will keep teeth from crowding. And this is another one of the flat plane Biteguards for people with TMJ or joint issues. TMD, you've heard of it. And typically there's some infection in the joint and some other hormone issues and some low electrolyte issues with people who have TMJ. And so that's just a sample and kind of some different options. And of course there's lots of clear braces now, lots of different kinds of clear braces that look pretty much like this that can straighten the teeth. And you wear this for a week or two and then get a new one and a new one, and it'll slowly straighten the teeth. So we do all of those services. I just wanted to clear up a little bit of confusion and show you some options.